Bismillah Rahman Rahim. Assalamu alaikum. Today I will talk about 4 minutes format. So, what's the meaning of 4-minute format in MRCPCH Clinical exam? In MRCPCH Clinical exam, if in history taking station, so they will give you 4 minutes before you are going to enter in the exam, and they will provide you a blank paper and a pencil. So you should have to write the format of history and what you should have to write if you will spend these 4 minutes in a proper way, and you wrote the format in a proper way. You will not miss anything in the history, and there is a good chance that you will get the full marks. So this it means if you spend a proper way and you write the format of the history in a proper way, 50% work has been done. So you will get the good chance that you will get the full marks because you have a scenario in the exam. I will not go in details today, only I will tell you the headings or topics of this format. In next video, I will go in the details what you should have to ask. Okay, before I am going to tell you about this framework or structure or template, whatever you should say in these 4 minutes, you should have to complete these 4 P's and V and S. So before I start, please subscribe and like, and if you have any query, any question, you can write a comments. So 4 P's and V and S. So this is every word it has some meaning. This is the short form or mnemonic, whatever you should say. So during 4 minutes, you should have to practice, like you should have to practice that you all these format you should have to write in 3 minutes. Why I am saying 3 minutes? Because 1 minute definitely you will read the scenario, and in scenario if there is, for example, if anything you should have to write differential diagnosis. For example, if the chronic joint pain for 4 weeks 6 weeks, so this is the chronic joint pain. So you should have to write the differential diagnosis of that joint pain. It could be JIA, leukemia, trauma, whatever differential diagnosis comes in your mind of chronic joint pain. You should have to write a differential diagnosis on that paper. It will help you inside the exam. You will go accordingly. So 4 P's and VS, this is the format of the history taking station. So every P contains something, like for example 1 P, first P is present history. So this present history systemic review also come in the present history. There are other things as well. We will discuss in the next video. Past history is also important to know, because in past history you will get lot of things like past history mnemonic is 40s IOA. And perinatal history, in perinatal history there is antenatal, natal and postnatal history you should have to ask, and you have to modify accordingly. For example, here you will see the fourth P stands for pubertal history. You will not ask pubertal history in 3 years old child, right? So pubertal history you will ask if it is a girl 8 plus, then you they can have a puberty 8 plus. You will not ask 5 years old girl about the history of puberty. And for example, boys 9 years and plus, then you would ask the pubertal history. You will not ask the 3 years old boy having a puberty problem, right? So this thing you should have to modify accordingly, according to the scenario, according to your case. You should not have to follow these things like the computer. No, you should have to modify the things as well. Okay. So allergy, so 4 P's has been done: present history, past history, parental history and pubertal history. So this is the only format, only you can say the short form. You will write 4 P's and VS. It will help you in the exam. So now you should know about the 1 P is a present history, other P is a past history, and the parental history and pubertal history. So this will help you. 1 2 3, it will help you, right? Then you'll go for the allergy. History of allergy is also important. So if, for example, a patient who is having asthma, a patient who is having peanut allergy, you will go in detail in this history. Eczema, so in detail in history. food allergy, anything. Otherwise, you will only ask the one question if there is a no concern in the history, like is she having or is he having any kind of allergy from any food or any medication or drug, right? And then nutrition, dietary history, which is important. Again, the child, if it is a failure to thrive, a child is having less than 2 years of age, you will ask dietary history in details. But if child is normal growth, development is normal, only one question can rule out this dietary nutrition history. Okay, development and growth, again same, you have to modify accordingly. If you think that in the history there are some concerns of development, there are some concerns of growth, you will go in detail. For example, in we have four developmental domain. In motor there are two, and in cognitive there are two. Like in motor, the gross motor and fine motor, and in cognitive we have speech and social. So these four domains, you should ask one or two questions if less than 2 years of the age in the history, which is rare, or if there are developmental concern, or if it is a failure to thrive or developmental concern, then you should ask in little bit details. But otherwise, you can ask one question: is he from the mother, mom? Do you think that his develop? Do you have any concern of his development? Does he look his development is like his peers? So if there are no concern, 8 9 years old boy or a girl, if no concerns in one question, you can get rid of this D, which is development and growth. If less than 2 years, if there is a failure to thrive, if any concern of development, you will go in details. You will ask one or two questions from every domain. Like for example, you will ask from a gross motor one question or two question, you come up with the age. It means you should know that this child is delay. History, you can tell the examiner, developmental history, this child has global developmental delay or isolated developmental delay. More than two domains means global developmental delay. Then don't forget about the vaccine, about jabs, which is important as well. Vaccine you should have to ask. And at the end, S, so V for vaccine, A for allergy, N for nutrition dietitian, D for development and growth, V for vaccine, and S means social history, family history, psychological history. Okay, so this social history and psychological history, it could be of the parents as well and a child also. Okay, if child is old enough, you will ask about the behavior. Either child has a friends, how is he in education, and socially like friends, how does he behave with the siblings, how is his behavior with you, and the psychological impact on the family and the parents. So how it impacts on your life of his condition. So these things, family history, this is also you have to modify family history. Definitely you will ask about the family members, about the housing, about the financial. This is also important. So financial history as well comes in the family history. Any disease in the family, similar kind of condition in the family. So family history is very important. For example, if it is asthma, if it is eczema, if it is kind of allergic things, then you will go in that detail. So this history taking is the art, and you should have to learn this art. So you will ask about if there is a allergy kind of things like asthma, like eczema, allergic rhinitis, any history kind of these things, then you will go in detail. For example, you will ask about the floor, is it laminated floor or carpet floor, any building works near your house, anyone smokes at home, pets. So this all you have to modify accordingly. You have enough time to ask these kind of questions. I will make other videos in details about the present history, past history, perinatal and pivotal history. It will help you in the exam. I recorded this because I have noticed that many candidates who are not writing this format, this template, or this 4 minutes framework in the before station, and they lose the marks because they definitely, you are human beings, you will forget some kind of things from this. If you will write, you have 4 minutes framework is good, and you are good in you did a good practice, then it's less likely that you will forget anything, and you will have a good chance to get the full marks. So 4 minutes framework is very important, and you should familiar of this, and you should practice in 3 minutes. You should have to write everything. In 1 minute, you will give the for the scenario and differential diagnosis. Thank you very much, and thank you for watching. Like and subscribe, and I will record in other videos. If you have any query, you can comment. Thank you very much.